right, thanks so much, Gerard. Well, this is the final day of Breast Cancer Awareness Month. And wow, what a memory. 7 years ago, I had my final chemotherapy treatment, rang the bell there, and now I am one of hundreds of thousands of breast cancer survivors. And we are grateful for our husbands and our friends and all of the people who fought with us and for us. There's my husband, Ed, right there. And one of the other people who helped me in the fight is Dr. Robert Belt. And he was my medical oncologist at St. Luke's on the Plaza. He is retired now, but he joins us here. And he's really a legend and a rock star in breast cancer in Kansas City.
I don't know about that.
I mean that. We're talking about 30 years of helping to treat women in breast cancer. We've got to be, that's thousands of women, you know, that you were there for, that you helped. What goes through your mind as you think about that history and what
Well,
you
that's
did?
very nice of you to make those accolades. I'm not sure that they're totally deserving. No, I think the best part of it was that we saw an evolution occur where you went from women who had problems for which there was little, if any, treatment that would be successful, to treatments which were very successful, and the survival rates went up during that time. So I think that's still ongoing. It's not that it's not that there's 100% survival or anything like that, but clearly the survival rates increased significantly.
Yeah, I really get a little tender-hearted when I look at you and I think about all the other doctors, you know, Dr. Shook, my surgeon, and really what you've meant for this breast cancer community. As we come in helpless, and all of us are wondering, what in the world caused this? How did this happen? What is the cause of breast cancer? Have we gotten any closer? Are there any thoughts that you have about what we can do for prevention on this?
Well, obviously there are some genetic issues here, and there are women who have the so-called BRCA1 and BRCA2 mutations that have nearly 100% risk of getting breast cancer, and often at a younger age. Beyond that, the known risks are exposure to radiation, and then that's the second one that might be, for example, people who might have gotten radiation therapy for, I guess, acne in the old days, or for other forms of tumor, like in the lung or something like that.
Right, so
their
those
risk
are
is
some thoughts.
increased, yeah.
Wow, that's interesting. All right, so what is your advice? So, you know, 30 years in the profession, what is your advice now to women who have not yet been diagnosed, and then to survivors who are concerned about recurrence and wondering what we can do to reduce our risk?
Well, clearly for the population in general, the best way of helping yourself out is to get the mammogram. And that's the best way of diagnosing this, especially some of these younger people who have the genetic mutation, and it's obvious that those people need to be followed from a very younger age. Also, the other thing is that the technology for diagnosing it is improved so significantly. The mammogram itself has improved, and all of the sonographic techniques that we have for examining these things now have all improved. Finally, beyond that, recognition that the genetic component of the cancer is significant. As a result of that, we have developed for women who have estrogen receptor positive tumors therapy which is not as toxic, is not, and is beneficial. But also we've been able to develop methods of assaying tumors to see what gene has been mutated and come up with gene-specific therapies for those patients with that. So all of that has improved our ability to treat people, and we've just developed a lot more information and knowledge about breast cancer and how it behaves. Yes.
Yeah, how it can. All right, all interesting information. I know that right now there are thousands of women who are watching who, you were their doctor, you were their medical oncologist. So if you'd like to send a shout out to Dr. Belt, just hit me on my Facebook page and I'll forward it along to him and let him know just how many of us really appreciate
No, I'm not sure about thousands, but hundreds.
Well, thank you so much for all you've done for me.
Well, Cynthia, thanks for you and all of your efforts for the breast cancer community. Especially, you've got your little
breast cancer pin
button. Yeah.
Thanks so much for coming.
You bet. My
Great
pleasure.
Job.
Thank
Love
you.
you.